Dear children, today is the third day of Swachhata Pakhwada, 2-week cleanliness drive program. In this present situation of COVID-19 pandemic, the government and other competent authorities have made many successful efforts to ensure hygiene and social distancing, which are the most effective ways to stay safe from coronavirus infection. Awareness is also the main shield to prevent the spread of COVID. Today, on Community Outreach Day, we have organized a special talk on the theme of Swachhata to promote cleanliness and COVID-safe behavior among children. We have with us Dr. Kavitha Mole, Assistant Surgeon, CHC Andurkonam, Trivandrum, to brief us on the importance of hygiene in our daily life. Let's listen to her.
Dear parents and children, first of all, thank you for the nice introduction. First of all, I am sincerely thank you, all of you, teachers and principal, for arranging this wonderful session in relation with the Cleanliness Week. This topic is very, very relevant in this situation because we have already faced the first and second wave of COVID. During both of that phases, the elderly and adult population were mostly affected. Now the situation is different. We have already started the vaccination for the adult and elderly population. We have almost completed the 50% of the population already. But the vaccination for children are not yet started. It will come within months also. We are expecting like that. So we have to emphasize more on these COVID appropriate behaviors for few more months, because the government has already taken decision for opening the schools within a month. So we have to teach all children in our home itself for making these COVID appropriate behaviors as a habit, so that they will continue same in the schools and among their friends also. That is why I am telling this topic is very, very relevant. So we will move on to the topic. Now we will move on to the topic COVID appropriate behavior in children. Everybody knows about COVID-19. That's a viral disease which is caused by coronavirus named as SARS-CoV-2. It is a disease from 2019 onwards. It is already spread all over the world. So everybody will be knowing all about the COVID-19. But I am specifically stressing on the hygiene as well as the cleanliness part related to COVID-19. So first we move on to the modes of transmission of the virus. How we get that infection? Mainly, we get the infection by coughing or sneezing by an infected person, then accidental inhalation of infected droplets, then the touching infected surfaces, and last one is direct contact with the infected person or infected surfaces, like shake handing, like that. So the modes of transmission is very, very important, because this is the part we can prevent the disease by making all these COVID appropriate behaviors properly. Move on to next slide. I will discuss the preventive aspect of COVID-19 in 4 headings. First one is mask, importance of mask, then hand hygiene, respiratory hygiene, and social distancing. So first we will discuss about masking. Everybody is wearing mask, especially in our state, including children. But my question is whether we are using the mask properly. We have to wear the mask properly, otherwise there is no use in using the mask. Because nowadays many persons are coming to OP as well as supermarket, everywhere they will unnecessarily touching the mask in front of the mask frequently, and most of the person are talking, pulling down the mask up to the level of neck. So it is not a good practice. So we have to, everybody knows this wearing mask and techniques, but they are not in a actual technique. That is why I am stressing we should wear the mask properly. First of all, I will talk about the mask wearing technique. Then we will go on to removing the mask technique. Both are very, very important. Before you wearing a mask, you have to select a suitable mask. Either it is a cotton mask, surgical mask, or N95 mask. Nowadays, we are promoting double masking. That means using a cotton mask along with surgical mask. Before going to wear the mask, you should clean your hands with soap and water. If soap and water is not available, you can use hand sanitizer also. Whenever you are using hand sanitizer, it should contain at least 70% of alcohol. So after hand washing, you can hold the mask by both the ear loops and place the mask ear loop on each ear. Don't touch front of the mask. Then you can mold or pinch the stiff part to the nose. Then finally you can pull down the mask to cover mouth and chin. After that, do not touch the front of the mask. This is the proper way of wearing mask. Then move on to the removing technique. It is, we should take an extra careful. Most of the person get the infection while removing the mask, because we will unnecessarily touching front of the mask. So before going to remove the mask, also you have to clean your hands with soap and water or rub with a sanitizer. Here we should not touch the front of the mask. You can remove the mask by taking both ear loops and throw it in a dustbin. Never throw the mask in common places or any other places, because it is a biohazardous thing. You can say, dispose that used mask appropriately, like burning or some other ways. It is also very, very important. After removing the mask, you have to clean your hands with soap and water. Then the second part is hand hygiene. Hand hygiene means everyone is washing your hands with soap and water, but the WHO already introduced 7 steps for hand washing. I will go through the slides, or you can view in my slides also. Hand washing means you have to wash your hands with the soap and water for at least 40 seconds. That means you should wash your hands all aspects. That means inner aspect, outer aspect, interdigital areas, knuckles, including wrist. So it will take at least 40 seconds. If soap and water is not available, you can rub it with sanitizer till you feel dry. Some do's and don'ts regarding hand hygiene. Wash your hands often with soap and water for 40 seconds, especially after you have been touching public places or after blowing your nose, coughing, or sneezing. Like that, use a hand sanitizer or sanitizer if water is not available. Then don'ts regarding hand hygiene means touch your face, eyes, nose, mouth or with unwashed hands. Avoid touching surfaces like doorknobs, doorbells, elevator buttons, handrails, support handles, chair backs, ATM surfaces, mobiles, jeep handles, etc. So we should be careful about this also. Then move on to the next slide. These are the WHO prescribed steps. You can go through the slides. Then move on to the respiratory hygiene. Everybody will be knowing cough hygiene and all, but in medical time we are using respiratory hygiene. Respiratory hygiene is a combination of measures taken to stop the spread of germs through respiratory behaviors like coughing or sneezing. That means do use a handkerchief or tissue to cover your face with while coughing or sneezing. Do throw the used tissue immediately into a closed dustbin and do cover your sneeze into your band of apron in case of this handkerchief or tissue is not available. Do not use any other ways like covering your face with the end of sari or shawl. And also always avoid spit in open spaces. You can use wash basin. This is very very important in case of spreading of COVID-19. So we will move on to the next slide. Social distancing. Nowadays it is not at all seen. Social distancing means deliberately increasing the physical distance between people to avoid spreading of illness. Staying at least 1 meter from other people lessens your chances of catching COVID-19. Then do stay at home unless absolutely necessary. Keep a distance of at least 1 meter between yourself and another person. Do not hold events where people have to gather, even if it is a corner meeting with 3 or 4 friends or evening chat on the chapel. Do not go through crowd places like markets, shopping meals, parties. Do not always try to avoid public transport for conveyance also. These are very very important. Okay, then finally few words about vaccine. This is the ultimate preventive measures we are promoting. Nowadays the vaccination is already going on from 16th January onwards. So as far children is concerned, the vaccination not yet started. It will come in few months. So we have 2 types of vaccine in India. 3 vaccines are available in India. One is Covishield, second one is Covaxin, and third one is Johnson & Johnson vaccine. It has got a recent approval for emergency use. So we can choose any one of these vaccine from nearby hospitals. The objectives of the COVID-19 vaccination is ensure that all eligible groups receive the vaccine with confidence, all people get correct information and are not influenced by mis or disinformation, myths or misconceptions. Then, what are vaccines? Vaccine is a product designed to help prevent disease. Vaccine can help individuals from getting diseases such as chickenpox, influenza, recently COVID-19 also. So, our main aim of vaccination is attain herd immunity by vaccinating at least 60 to 70% of the community for attaining herd immunity. From that way only we can contain the disease, because the virus is all over the world. We cannot limit their movement, not at all possible. So we will mainly depend on vaccines. The preventing the aim of aim of the vaccination is preventing a disease from spreading. Here the COVID-19 vaccine, no COVID-19 vaccine is made using the whole killed or weakened viruses. So we can safely take the vaccine. One vaccine is made with a piece of COVID-19 COVID virus, and two are mRNA viruses. So any virus contains the whole virus. So we can take the vaccine without any hesitance. None of the vaccine can give a person COVID-19. That we can assure. So still the vaccination is going on. Some points are still on the research or study part. What are they? When this herd immunity will be reached, that we cannot say at this moment. As well as if the virus can be passed by those vaccinated, that we have to prove by time. Then how long the vaccine protection will last, and when everyone will get vaccinated. These all our questions are still we cannot define. So our measures is to continue with all these COVID appropriate behavior for few more months to years. How it will take, that I cannot say now. So the public should continue to follow public health recommendations like wear a mask, frequently wash your hands, stay 6 feet from others, stay home as much as possible. That is the only measure we can continue. So every parents and children should continue all these COVID appropriate behaviors in your home as well as in your working place or wherever you go, like supermarkets, any other places. You should wear your mask properly, wash your hands frequently, then make a social distance also, at least 1 meter. Okay, thank you all of you for patient listening. Thank you.